brain. My particular branch of pathology involves examining brains from patients who've had an autopsy. And an autopsy, or postmortem examination, is done in order to determine why the patient died. This is a brain that's already been cut, and I just have to document it using photographs. The patient was an 89-year-old woman who had dementia, that is, she had lost her mind, and the family is very interested to confirm what kind of dementia that she has, because some of her, a sister, I believe, was also affected by a similar condition, and they're afraid there might be something in the family. So that's why we're doing this case in some detail. This case is also what we call an outside case. That is, it's from another hospital, and in this case as well, the patient is thought to have some kind of dementing illness, and the family is very intent upon having an examination so that they can understand more about what's going on in the disease process. Obviously, because it might be hereditary. Now, I don't have full information on this patient, but in looking at the brain, we can see that the patient was an adult. Normal brain will weigh about just about this much, as a matter of fact. 1350 is a pretty good weight for a male brain, and so there's not very much atrophy here. There is this same process of atherosclerosis that we talked about in the other case, and so this patient does have hardening of the arteries. The reasons we do these medical autopsies is to answer questions from the family. Sometimes if the family understands that this is or could be a hereditary disease, then they're very interested in getting as much information as they can about it. And so we try to cooperate with them about that. As a matter of fact, at least a third of the autopsies that I do are specifically requested by the family. This part that I'm cutting right now is what we call the brain stem, and it is the part that serves the automatic functions of the body, such as breathing and heart rate and blood pressure and stuff that we don't want to have to remember to do. So they're done automatically as if they were on a thermostat control. At the same time, when something presses upon this particular part of the brain stem, the patient is likely to die very quickly. So it's a dangerous business to live with this stuff. Okay, one small stroke, and we'll get some microscopics and look for Alzheimer's changes. But little strokes like this are becoming much less common. During the earlier part of my career, when people were still eating barbecue with fat on the top and all of that stuff, all of that great stuff, there used to be a lot more strokes. One of the things that happens is that the disease processes stay the same, but the names for them change, the names for the diseases change, and our understanding of the diseases changes. And so you have to keep up with not so much the disease itself as the concept of the disease. And there really have been a lot of advances in the understanding of how diseases occur, and also how to examine them, how to measure them, how to find out what's going on. Now, there's a lesion in this slice, and I want you to tell me what it is. So, Corman, you're first. Look at it, and if you don't know what it is, we'll give it to Conway. If you don't know what it is, then Heather gets it. X-ray next.
Okay, I just think there's sort of like a cystic area
A cystic area, okay,
right
good.
in there.
Good.
And it looks like it's between the, what is it, globus pallidus and
Yeah, in fact,
cutaneous?
I would say it's in the outer segment of the globus pallidus right here.
Uh-huh.
And you can see that it is a little cystic area.
Right.
Okay, so what is it?
An infarct.
Yes. Is it an old infarct or a recent infarct?
It's an older infarct because
Why?
it's cystic and because it...
All of the necrotic stuff has been resolved, right?
Right.
Okay. Now, which vessel supplies that part of the brain?
Middle cerebral.
Right. From this middle cerebral artery right here, many small branches arise, penetrate into the brain right through there, and so what's happened is that one of these penetrating or lenticulostriate arteries has been occluded either by the atherosclerotic process or by a thrombus, and that caused a small stroke here. Resident, as you've seen, there are resident physicians around all the time. There are also medical students who come and go, and we try to teach them what we can. We have both formal didactic lectures. There's a lot of textbook material. As a training institution, the doctors that we train go off to work in other hospitals and in other parts of the country. And one of the things that we have to do as we're training these doctors is to make sure that they know what they're supposed to know. This is the covering of the brain. We call this the dura mater because it's so tough and leathery. And when the brain is in place in the skull, this fits over the top of it. It contains some blood vessels which drain the blood from the brain, and then inside we can see these different compartments that are divided up to hold the cerebral hemispheres and the cerebellum. And so this is called the dura mater. Once in a while you'll see blood clots between the brain and the dura, and that's fairly common in alcoholics. Show that to the camera because if a Rice student drinks too much for too many years, the anterior part of the vermis right here will become withered and atrophic.
Did you go to college, Dr. Kirkpatrick?
Rice.
Oh, okay.
My cerebellum don't work so good either. Wide base
Me, that's a rock scholar.
Once in a while you see the phenomenon of what we call death house humor. You saw a little bit of it at the conference today, but in a way that's a defense mechanism to break the reality of such genuinely tragic issues and be able to deal with them psychologically a little bit better. We are not trying to make fun of the dead or trying to embarrass their relatives or anything of that sort. It's just a sort of a coping mechanism. But it's called death house humor, and sometimes it's pretty funny. For instance, in the autopsy room where I received my training, there was a little box on the wall, and it said, had a glass cover over it, and it said, in case of emergency, break glass. And inside the box was a Hollywood steak, in case any of the patients happened to be a vampire and required killing.
Dr. Kirkpatrick, what's the correct pronunciation of those hemorrhages? Is it Durette or Durette?
I call it Dure. It's spelled D-U-R-E-T, and the guy was a Parisian. So it seems like to me that Dure would be the correct pronunciation. And besides, all of my teachers always called them Dure. But of course the French mispronounce everything anyway, so you can't really tell. What's the name of that quarterback? Bear.
Hebert. Herbert.
Well, the quarterback for the Packers is spelled Favre and they pronounce it Favre.
You probably pronounce it a lot of other ways too. By the time I got into medical school, I decided that I was going to be either a pathologist or a general practitioner. And then I met some general practitioners, and they turned me off so much that I decided it was going to have to be pathology. And I did find pathology intellectually stimulating and really interesting. And it's worked out that way. Every day's a challenge. I never get bored.
You're moving on, going to Albuquerque for a month.
Oh, are you? For your forensic work?
Yeah, back to Zumwalt.
Oh, great.
Yeah.
Well, tell him I'm alive and well.
Okay, I will.